As a busy clinician, you'll likely see patients who can't sleep or feel irritable. PTSD is a common source of these symptoms, not just among veterans, but for anyone who experienced trauma. And 60% of Americans experience trauma in their lifetime. So it's worthwhile to administer a primary care PTSD screen to identify if PTSD could be the underlying problem. It's only a few items, and it's a free download from the National Center for PTSD website. If your patient does have PTSD, let's get you up to date understanding the best treatments. For PTSD, you have evidence-based options. PTSD symptoms can be treated effectively with SSRIs and SNRIs, like sertraline, paroxetine, or venlafaxine. Two types of cognitive behavioral therapy, CBT, teach lifelong tools with lasting results, even after a short course of therapy. Cognitive processing therapy, CPT, and prolonged exposure, PE. Another psychotherapy is also effective, EMDR, eye movement desensitization and reprocessing. A huge advantage of psychotherapies is that there are no unpleasant side effects or possible medication interactions. Plus, they're more effective for treating PTSD than medications. Sometimes patients with PTSD just want to work on specific symptoms. For insomnia, effective medications include a trial of low-dose trazodone, amitriptyline, mirtazapine, hydroxyzine, or low-dose doxepin. For trauma-related nightmares, prazosin may help. Consider referral for CBTI, short for Cognitive Behavioral Therapy for Insomnia. It's a highly effective psychotherapy that can significantly improve sleep in relatively few sessions. It's not always readily available, but worth seeking out for patients. For anxiety, treatments for PTSD we've discussed, like CBT and antidepressants, can help. The patient might be experiencing hyperarousal, part of their PTSD, rather than general anxiety or worry. Here's some news that might surprise you. Evidence shows benzodiazepines won't work for PTSD and may interfere with CBT. Atypical antipsychotics are not effective for PTSD either and carry metabolic side effects. Help your patients stop this cycle of medications that don't work. We know, my patients are on them, they really think they're helping, and you want to take them away? Consider this. These medications may seem like an easy fix for insomnia or anxiety, but why risk creating a problem down the road when there are more effective treatments? Patients with PTSD can recover. Encouraging the most effective treatments gives your patients the best chance to get better. For more information or to download PTSD screening and assessment tools, visit the National Center for PTSD website, www.ptsd.va.gov.